The application of genetics to embryology is a very unique and a dynamically evolving one. Traditionally, embryo selection has always been based on how beautiful an embryo looks at the time of transferring or selecting it for the patient. Nowadays, we have genetic tools which use next generation sequencing, for example, to look at the insight or the genetic insight into what an embryo is doing. So for patients who've had consistent failure at IVF without achieving a pregnancy, one of the tests that you can do is look at the genetics of the embryos. So this is done by taking a small biopsy of an embryo when it reaches on day 5 or day 6 after fertilization. This stage is referred to as the blastocyst stage of development, when the embryo is typically around 90 to 100 cells. So around 5 to 6 cells are taken as a biopsy from the embryo in a very skilled manner using lasers. And these biopsies are then sent to genetics labs for testing and reporting back on the genetic status of the embryo. The other application of genetics that has been very successful has been pre-implantation genetic diagnosis, is when patients inherently carry a mutation or a genetic defect within themselves. And in order to prevent the transmission of the faulty gene to their offspring or to their children, either because they have already had an affected child from, for example, cystic fibrosis or beta thalassemia, or an inherited cancer, they would like to have their embryos screened before they plan any future pregnancy. And as a result, IVF comes in, whereby the couple have to create embryos in the laboratory, and we would take these biopsies and get the genetic screening done for the specific disorder that the patients are having screening for, in the pursuit that they will get pregnant with a healthy child that is free from the genetic disease in question.